Hello, my name is Dr. Metha. I'm a board-certified emergency physician, and I will provide some simple instructions regarding your aftercare. We hope that this instructional video proves to be useful, but please remember that this video does not replace the information that your individual physician in the emergency department provided. It is meant to supplement those instructions. If there are any questions or concerns, please contact the facility that treated you or your private physician. We are pleased that you gave us the opportunity to evaluate you for your scalp wound. A scalp wound is a cut in the skin around the head. Sometimes with scalp wounds, you may also have underlying head trauma like bleeding in the brain. If you were seen and discharged, this most likely means your head trauma was not severe enough to be treated in the hospital. You may exhibit signs of confusion, short-term memory loss, and headaches. You may also be diagnosed with a concussion. If this is the case, you may not return to sports or physical activity until all of your symptoms subside and your physician clears you. You must also be under the care of a family member or close friend for the first 24 hours so that they may monitor your mental status. Return to the emergency department or your private physician immediately if you have a persistent headache, neck stiffness, severe vomiting, changes in mental status, or if you begin to feel worse. With scalp wounds, you may have either sutures or staples placed to close the wound. If you have only external sutures, meaning those on the skin, then it is important to keep the area as dry and as clean as possible. This can be achieved using soap and water to clean, but then drying the area immediately after cleaning. Peroxide can also be used to reduce crusting, and the use of an antibiotic ointment such as Neosporin will keep the area clean and makes taking the sutures out easier. You can shower after 24 hours, but again, do not soak the area. Also, activities such as swimming and bathing should be avoided until the sutures are removed. If you suspect that the repaired wound is getting infected, then please go back to the hospital that put them in or see your private physician immediately. Important signs of an infection are increased or spreading redness, draining pus, separation of the wound, or increased pain. Follow the instructions provided to you by the doctor who placed the sutures regarding the timing of removal. Usually the sutures are removed in 7 to 10 days. If your wound was repaired using staples, then follow the same instructions I just gave. You will most likely return to have your staples removed in about 7 to 10 days as well. Thank you for taking the time to view this video. We hope that you find it helpful. Again, follow your treating emergency physician's instructions as your situation may be unique.